Welcome back to another Bali COVID-19 update. This is January 5th, 2022. My name is Bruce. So there are a lot of things today, but my internet was down for 24 hours yesterday. Yes, 24 hours. It's amazing how dependent you can get on this, especially if you read the news compulsively like I do. Like I said in the last video, I'm going to start out with the main story, but today, two main stories. We're going to talk about those first and then go into the numbers. First, let's talk about the drop in the quarantine from 14 days to 10 days and 10 days to 7 days. And you remember a video or two videos ago, I was talking about the people who, well, got away with not doing quarantine. Well, Jokowi was upset, according to this article. Jokowi reportedly upset over soft quarantine rules against Omicron. So, at a cabinet meeting on the 26th, they were discussing the development of the Omicron variant, and according to reports, the president slightly lost his temper in the meeting. Why was he angry? Well, he was angry because of the leeway given to certain people, that is, members of the House of Representatives and celebrities who managed to skip the quarantine procedures. And now you listen to this story and listen to the one that's coming up next. According to three government officials who joined a limited meeting, Jokowi also opened the option of extending the quarantine period from 10 days to 14 days. This option then would become policy as of January 1st. So this was done after that meeting on the 26th. So we're like a week away now. So Jokowi was looking at extending the 10-day quarantine to 14 days. You know, Monday nights are times when somebody from the government, usually Luhut, comes out and makes some pronouncements about what the government is going to do. Well, he did that on Monday night, and according to Luhut, it's been decided that the 14-day quarantine will become 10 days and the 10-day quarantine will become 7 days. Remember the previous story? President on the 26th was looking at extending the 10 days to 14 days. And now, a week later, they're going to go back and take the 10 days and make it 7 and the 14 days and make it 10. Well, this is not official yet. There has not been an official document released on this. This is just what Luhut said during his press conference. And so we'll have to wait and see. And so this is an update to the drop in quarantine, well, the supposed drop in quarantine from 14 to 10 and 10 to 7. This is the government's reason for reducing the quarantine period. So, according to Luhut, this was due to the coronavirus pandemic situation in Indonesia, which continues to show improvement. He said, all numbers are improving. Maybe 2 days later, there were no deaths in this COVID case. That's the 26th of December and 2nd of January. And so there's 0 deaths, he said. He did acknowledge that we have a rising number of Omicron cases here, but he said the government is prepared to deal with the spread, and vaccines continue to be intensified and medicines are continuing to be prepared. Luhut said that the controlled pandemic situation in the country is the impact of discipline of public health protocols that are still being applied, starting from wearing masks, washing hands, maintaining distance, and following vaccinations. Okay, maintaining distance. Yeah, well, I've said this since the start. There is no maintaining distance in Indonesia. Now, there was a little heated discussion today on social media about whether this drop from 10 to 7 applies to just Indonesian citizens or to all people coming in from overseas. The way I read it is it applies to everybody, but we're not really going to know until the official notification is out, and even then we might not really know, because sometimes the official notifications are somewhat vague. But we'll just have to wait and see, as I often say. So what about Omicron in Indonesia? Well, 2 Surabaya residents detected with Omicron, and bad news for us in Bali. So according to the mayor of Surabaya, the tracing was done and it showed that the patients were in Bali returned from Bali, and it's one family, so two patients, asymptomatic. They're currently being treated in the hospital. They returned from this vacation in Bali. It was a family vacation. And so there's no news here, no information in this article about whether tracing is being done in Bali, where they stayed, where they went, what restaurants they went to, who they came in contact with. There's a possibility that they were already infected when they went to Bali, in which case they could have been spreading it around while they were here. Maybe they picked it up in Bali. That's quite possible. Maybe they got it when they got back to Surabaya. It doesn't say how long they were back to Surabaya, so there's not a lot of information in this article, and I expect to see more coming up in the following days, especially if we've got the possibility of having it here. That is going to be a big issue, because today we had one case and no deaths, and so, wow, things could just change like that. As if you read comments from the last video that I did, you see what's happened in Australia, and in the video I mentioned what was going on in the US, and so we're just kind of waiting for the hammer to fall here and see what's going to happen with Omicron in Bali. The good news is that these patients are asymptomatic. More anecdotal proof that the virus is relatively mild compared to, well, certainly compared to the Delta. And an update on the two patients from Surabaya that were in Bali. Omicron patient from Surabaya had 6 days to stay in Bali, visited a number of tourist attractions, and so both of them were in Bali, as I mentioned in the first part of this segment. Where were they in Bali? Well, according to the head of the Bali Provincial Health Office, Ketut Suarjaya, the patients came to Bali by land, and they visited a number of places from the 20th to the 25th of December. They stayed in the Nusa Dua area, and they visited a number of tourist attractions, but they're not sure which tourist attractions they visited. According to Pak Surjaya, he forgot where he was and who he was with. What is clear is that he traveled to several places, but he doesn't remember who he met with. He said to tourist objects, but because he's currently being treated at the hospital, it's a bit difficult to contact him. What a mess. Pak Surjaya, well, agreed that it was a bit of a mess. He said this was a bit of a hassle. But he said he'd used the Peduli Lindungi application. And a team has been sent to the location where the patient was staying, and tracing is being carried out. And PCR tests will be given to people who had contact with the sick folks. And Pak Surjaya asked the public to immediately report to the nearest COVID-19 task force if they experience symptoms, such as COVID-19. He hopes there will not be a spike in cases. Okay, so it seems that we have the Omicron variant here in Bali. Just where? Well, who knows? And the mayor of Surabaya helped with all this and said that the entry of cases of this new variant in Surabaya came from outside the city. It's not them, it's us. The mayor said the same thing with the Delta. It didn't start here, it came from outside. How that helps with the situation, I have no idea. Maybe it makes the mayor feel better. And what about the numbers? The numbers are still looking good here in Bali. They are starting to rise around the country as well as many people suspected after the holiday period, and we'll get into that shortly. But let's take a look at the actual numbers right now. The 7-day average of new cases in Bali, 4, and the 7-day average for deaths, 0.6. So the deaths have gone up a bit, and remember the average number of new cases was 3 the other day, so we're inching up a little bit. New positive cases in Indonesia, 299. As I said, we're inching up. Well, going a little quicker than inching around the country. And the number of deaths was 3. Testing yesterday, 232,766 with a 0.13 positive rate, and the 7-day average was 0.14. Over the last 7 days, Bali has tested 39,971 with a 0.06 positivity rate. And what about the vaccinations? Well, the numbers have changed a little bit. And why have they changed? Because the kids, it looks like because the kids are being reported now. First dose, 3,851,439, which is 85.2% of the population. That's the real population. So, wow, great in first dose vaccination. Second dose, 3,105,231, 68.7% of the population. Kids are not getting second dose yet. And yesterday, 7,144 additional doses were administered in Bali. And what about Bali and new cases? Yesterday, 8 and deaths 1. Active cases, 62, so still down there. But remember now we're watching to find out what's happening with the Omicron variant, which I talked about just before this segment. And what about Omicron in Indonesia? Indonesia reports 92 new Omicron cases, bringing the total number of confirmed cases to 254. Of that figure, 15 are locally transmitted so far. Health Ministry spokesman Siti Nadia Tarmizi said that the Omicron patients experience symptoms like a common cold. The majority of cases are related to international travel, she said. Based on our examination, most of the patients have displayed mild symptoms or been symptomatic. So that is the great news. And that seems to be confirmed now around the world, that the symptoms, I don't know if you can hear the child screaming, but she screams all the time, constantly. If I was her parents, I would go insane. Ibu Tarmizi said the most common symptoms are cough and a runny nose. So how do you know if you've got it? If you have a cough and a runny nose? Because what did I have yesterday? I had a cough and a runny nose. But considering that I go out in a very limited space, just in my usual walking areas, which you've seen if you've looked at any of my Singaraja snippet videos, I don't think I've got it. I think I've got the common cold. In the past 24 hours, the country has added 299 new COVID cases, which is the highest daily tally since December 3rd. So, okay, numbers are going up, as I said, like expected after the holidays. Overall, since it started, 4.26 million cases and 144,105 deaths. Total number of active cases in Indonesia is 4,658. And here's a new release from the government, an official one, on the prevention and control of the Omicron variant COVID-19 case. And this is kind of long. There's a link here that you can go to if you want to read the whole thing. Basically what it says is if you're tested with the Omicron variant, or if you're in close contact, you are going to be quarantined for 10 days in a centralized quarantine facility and an entry and exit test using the NAAT examination. Criteria for complete isolation and recovery in probable and confirmed cases of the Omicron variant are as follows. In asymptomatic cases, isolation is carried out for at least 10 days since the confirmation of the diagnosis specimen was taken, plus the result of the negative nucleic acid amplification test, NAAT, for 2 consecutive times with an interval of 24 hours. In symptomatic cases, isolation is to be carried out for 10 days from the onset, plus at least 3 days free of symptoms of fever and respiratory problems, and the negative AAT examination results for 2 consecutive times with an interval of 24 hours. So what does this mean? Well, this means that once this gets spread, there's going to be a lot of people, I think, that are not going to get tested. Now, we know that that's already been happening. And so when we have the numbers, there's a good chance that the numbers are higher because of the people that don't get tested, that don't report that they're sick. And well, with the possibility, if you're asymptomatic, or if you're symptomatic and like me, you've got a cough and a sore throat and a runny nose, are you going to go and get tested and take the chance of being quarantined? I think there's going to be quite a few people that aren't going to, unfortunately. So we're just going to have to see how this pans out. And as I said, the link is below, and so you can read the whole thing there. And some problems at the airport. Extensive testing conducted after 9 airport officers contracted COVID-19. And so 9 staff members have tested positive for COVID-19. They reportedly live in a boarding house in West Jakarta. And the variant has not yet been determined, so no telling if it's Delta, if it's Omicron. That's undetermined yet. So far, some 74 residents around the boarding house have undergone PCR tests, and currently they are self-isolating at their respective homes while awaiting the test results. So we'll have to follow up on that and see what that works out to. As always, there's just follow-up. The numbers in Bali are still stable, but in Jakarta, they're going up. Jakarta, active cases of COVID-19 on the rise, Deputy Governor. And so the Deputy Governor, Ahmad Riza Patria, said the number of active cases yesterday increased by 103. On December 18th last year, there were 267 active cases. A week later, Christmas Day, 377. And on January 1st, 547, and they've gone up again. The Deputy Governor did not say why the number is increasing. He just reminded residents to stay on guard. Despite the increasing cases, the Deputy Governor said that COVID patients' bed occupancy rate in isolation wards and hospitals is still below 5%, and the occupancy rate at IC rooms is 4%, and medical supplies are still sufficient. And we talked a lot about travel. There was a lot of government announcements that don't travel. Here's a story on that. 49,000 people leave Indonesia via Soekarno-Hatta Airport on Christmas, New Year. 49,000 people. The figure was almost the same as international arrivals. So we have 49,000 people coming in, 49,000 people going out. According to the director of the airport, the numbers were from the period December 17th to January 3rd, but he stopped short of detailing travelers' destinations or their country of origin. And those 49,000 people are going to be coming back. And so what's that going to bring us? Okay, no telling. And vaccines and vaccinations. Nearly 1 million Pfizer doses arrived in Indonesia from Italy. And this is due to the COVAX scheme, and the government thanks the government of Italy for their support. And now with this 1 million, Indonesia has now received around 470 million doses, according to government spokesperson. And according to data provided by the Health Ministry as of January 1st, nearly 161 million, almost 162 million citizens have been vaccinated first time, and 114,041,953 have been fully vaccinated. Although I was reading the other day an interview with an American doctor, epidemiologist, who said we should consider the booster as necessary, not as a booster. So we should say you need to have 3 shots now to be fully vaccinated. It's going to be a while then before we get people fully vaccinated, if we go by that definition in Indonesia. More on vaccines and vaccinations. Government to roll out COVID-19 vaccine booster shots on January 12th. So the Health Minister, Pak Budi, said that booster shots will be given to adults over the age of 18 based on recommendations from the WFO. Based on recommendations from the WHO. I have no idea what the WFO is. I think it's a wrestling federation. He said it will be given 6 months after the second dose, and we've identified 21 million targets in January. So that's a lot of people. The government also stipulated criteria for Regency cities allowed to roll out booster vaccinations. They have to have done at least 70% of the target for the first dose and 60% for the second dose in order to give out boosters. And Pak Budi said up to now there's 244 Regency cities that have met these criteria. Booster rollout will be given based on the category of PBI, the government subsidized people, and non-PBI. PBI people will be given free booster shots, and non-PBI people will be able to purchase them. How much will they be? Still not determined yet. Okay, and so this is another one of these government announcements that they make several times before they really have the whole plan laid out. And what kind of vaccines? That's not determined yet either. Minister Budi said, hopefully a decision will be made on January 10th. And what about schools? And so my granddaughter is back in school. She is doing still 2 hours a day, but 5 days a week. And they have the class split up into 2 different groups. And so you're going to see something like this around the country, I think. Yogyakarta will not immediately implement 100% 70% face-to-face learning. And so they are going to be using a maximum of 70% right now to start, according to the Deputy Mayor of Yogyakarta. According to the Deputy Mayor, this policy is being carried out because of the possibility of transmissions through children or through teachers. And there's no requirement that students need to be vaccinated to be in school. And so it's quite possible that the kiddies can be spreading the virus around or that they can get it there. And the authorities are working at this 70% because they want to use this as a simulation to find out various obstacles to implementing health protocols that may occur if they're running face-to-face learning at full capacity. In the first semester in Jogja, schools are running at 50% capacity, 2 hours a day. Now in this new semester, this is the second semester, I don't know if you can hear the kids out here screaming. This neighborhood it's got two things in it. It's got a lot of really old people like me, and it's got a lot of kids. So the schools are going to ramp up eventually to 100%, but according to the Deputy Mayor, that could be after a few weeks or it could be after a few months. They have to see how things develop. And so hybrid learning is still going on because 30% of students are not going to be in school. And kindergarten and elementary students who have not been vaccinated are being encouraged to prioritize online learning at home unless they've been vaccinated. And the Deputy Mayor said they're going to speed up the vaccination process to get all the children ages 6 to 11 vaccinated for the new semester. And schools may open at 100% on the condition that teachers have been vaccinated. At least 80% of them have been vaccinated. And according to this article, more than 95% of teachers have been vaxxed, and students 90%, according to this article. So that's good news. Healthcare. I've been talking about healthcare and medical tourism recently, and I was mentioning the hospital being built in Bali, the international hospital being built in Bali. Well, here's another article on this. Indonesia loses out as citizens spend billions on healthcare abroad. The number of Indonesian patients abroad was 350,000 in 2006, and it moved up to 600,000 in 2015, according to PricewaterhouseCoopers. And according to a speech that President Jokowi was giving when he was at the groundbreaking for the International Hospital in Bali, that number is now more or less 2 million. And where do Indonesians go if they want to be treated overseas? The most popular places, Singapore and Malaysia, because, well, people think that they get better treatment there. And 80% of medical tourists in Malaysia come from Indonesia. Okay, makes sense. It's the closest place to go. You can get there relatively cheaply on Air Asia. And, well, accommodation is not as expensive as in Singapore. And supposedly the healthcare there is, well, really good. Heart and cancer diseases are the most common concerns for which Indonesians seek treatment in foreign countries. According to the chairman of the Indonesian Medical Tourism Association, Taufik Jaman, he said, "We must become a host for medical tourism. For now, we do not have to aim for Americans or Europeans, but let's think about how we can give better medical services to our residents first." Okay, this is like focusing on domestic tourism still. Taufik said the country could turn things around. The industries of healthcare and tourism should cooperate in order to make that happen and to improve awareness among citizens about the medical facilities available here. And the short-term goal should be to get at least 10% of the funds flowing abroad to stay in Indonesia. According to the Secretary General of the Indonesian Private Hospitals Association, local hospitals in terms of medical staff and equipment are quite capable of providing treatment Indonesians are seeking abroad. He said 10 hospitals in Jakarta and Surabaya have international accreditation and could convince Indonesian patients to opt for domestic rather than foreign treatment. He said that hospitals in India and Malaysia can attract tourists because of low cost for medicine and equipment, which they produce locally, whereas in Indonesia, mostly we still rely on imports. According to Indonesian Public Health Association researcher Bigwanto, he said the reasons for Indonesian patients going abroad are more complex than that, and they include doctors not providing adequate treatment, especially when outpatients come for counseling and consulting because of their high workload. Doctors often need to see many patients and work 2 or 3 different hospitals in a day, he said, because of their fees being low. And he continued that because people are disappointed with the treatment they receive here, they go overseas looking for better treatment. And according to Pak Bigwanto, the high workload was rooted in a long-standing problem, a shortage of doctors, because Indonesia doesn't produce enough doctors. Why? High cost of medical school is one reason. World Bank data shows that Indonesia has only 0.4 physicians per 1,000 inhabitants. That's the second lowest rate in ASEAN and below Timor-Leste, which has 0.7. And Timor-Leste is a much poorer country than Indonesia. Pak Bigwanto said many doctors have to work at a number of different hospitals in order to get enough money to pay back loans that they've used to pay for their tuition because of the high cost of medical school. And the health minister, Pak Budi, said that healthcare reforms are underway which could reduce the number of citizens going abroad for medical services. And that includes increasing the number of hospital beds, improving service quality and equipment, simplifying regulations to allow foreign health professionals to work in Indonesia. Now, that would be a big thing. People have been talking about that for a long time. And if we're going to get international tourism to work, international medical tourism to work, we're probably going to need people that are at least trained overseas. As I've said before, I've had some really excellent treatment here. My neurologist at Siloam, she was a gem. And I've also seen a dermatologist there. She was also a gem. I've also had some really terrible treatment in Indonesia. Really terrible. And I'm still in pain every day because of 2 screwed up operations. So it's kind of hit and miss. So improving the healthcare in Indonesia, wow, a great thing that will benefit everybody, and we could bring in some bucks as well if we get into the medical tourism. Time for a wrap-up update. And as I said, this is shorter than usual. I think it's going to be shorter than usual because I did nothing yesterday except some editing. The PPKM has been extended to January 17th. No surprise there. And an interesting story I wanted to talk about, but I just mention it here. We always take Singapore, or I always take Singapore, to be one of those places where everybody follows the rules. This was interesting. New Year's Eve gathering, a potential super spreading event, authorities warn. Authorities are looking into a big party that apparently was a spontaneous countdown party involving hundreds of people. Here's a photo. And so everybody in Singapore does not always follow the rules, including a good friend of mine who lives there who, well, he tries to get by them all the time. That's it for the update. What's the situation? Okay, the situation is we most likely have the Omicron variant in Bali. Don't know yet. This testing is still being done in the areas where the 2 people that were tested positive in Surabaya, where they traveled. And yeah, that's just a weird situation. Don't remember where they were, who they were in contact with. Wow, what does that mean? So we're just going to have to wait on that. The good news is that the symptoms, if you have them, are like a cold. The bad news is that everybody gets sick all at one time because of the high transmissibility. Some things are going to be shut down, like you see, and I talked about in the last video, in the U.S. And the proposed drop to 7 days for people coming in, that's really not going to affect international tourists coming in for short term. And well, at this point, I think we can just forget about that for a while. For Indonesian citizens coming in, they're going to welcome that. And for foreigners coming in on the B211 business visa, well, that's going to be a welcome sign as well, because people are still coming in with the 10 days. Still coming in, still see stuff on social media every day of people talking about their quarantine experience in Jakarta. So that's going to be great news for them to have 3 less days. And what about when we really get foreigners in here, short-term foreigners, real tourists? No telling at this point. No telling. But you can't, was it last video I think I said I didn't see the quarantine period being dropped? And bingo, there it is, it's dropped. You can't tell what the government's gonna do. And well, the crystal ball, you look at it and, well, my crystal ball is about as cloudy as the day. Weather is still wet. What is the wind speed? The wind speed is 3.1 meters per second and the temperature 31.3 degrees. Okay, and humidity 64%. And no rain right now. Okay, so if you want to come to Bali as a short-term tourist, not gonna happen for a while, unfortunately. People that are coming in the long-term, the B211 business is still working, and sometime, I guess, there will be an announcement, official announcement about the quarantine being dropped to 7 days, so that's a little better for you. If you found this video useful, helpful, or amusing, give it a thumbs up, please. And if you haven't subscribed, please consider subscribing. Updates are every Wednesday and Sunday, and I'm going to start doing some videos on Indonesian cooking with my wife, and I did one yesterday. Since I didn't have the internet, I had some free time. It didn't really work out the way I wanted to, so I'm going to do it again. And I'm going to start doing those on Sunday and probably put them up on Monday or Tuesday, but more on that to come. And there will be a new Singaraja Snippets in another day or two. I'm just about done. And if you want to see me almost get run over at the end of the video, that freaked me out. This guy came as close as can be. So thanks for viewing. Stay safe. Be kind to someone today. And if you want to get here, keep hoping. And I hope wherever you are having the start of a good new year. And I will see you on Sunday.